Well, good evening, TCM Gynecology and the greater Chinese medicine world. This is Michael Peluso from TCM Gynecology. I am joined tonight with Dr. Heather Peterman. Dr. Peterman is an acupuncturist, or as I prefer to say, a Chinese medicine physician at the Advocate Aurora Healthcare. And within that, in Milwaukee, Wisconsin, she also works in a fertility clinic as well as a hospital-based setting. Dr. Peterman has her DAOM from the Midwest College of Oriental Medicine, as well as her master's degree. And we're really excited to have her join us this evening and talk about PCOS and also touch in a little bit about hospital-based practices, how one can come to do those types of things. Although this will be a brief interview, there will be more time in the future for us to elaborate on this. So we want to welcome you all and thank you for coming and listening tonight. And Dr. Peterman, of course, thank you so much. Welcome.
Thank you.
It's great to have you here. Before we get started, what I thought I might do, since I have a copy of Dr. Peterman's doctoral thesis here, I thought I might read a little bit of an abstract to you so that you can get a sense of what Dr. Peterman's expertise is. And we will then ask her to elaborate a bit on this for the duration of our interview, as well as talk about practicing in the hospital setting. So Dr. Peterman, with your permission, I'm going to go forward with this. So
absolutely.
Okay. So treating the traditional Chinese medicine pattern of spleen qi deficiency as a root cause of female infertility in patients with insulin-resistant polycystic ovary syndrome during preconception care will increase pregnancy rates. The treatment of spleen qi deficiency has multifactorial outcome that allow the practitioners to effectively work within a subset of symptoms experienced by modern-day women who are now waiting until later in life to conceive their first child. So Dr. Peterman, this is in fact the abstract from her thesis, the title of which is Validating the Role of Traditional Chinese Medicine in Preconception Care to Increase Pregnancy Rates in Patients with Insulin-Resistant Polycystic Ovary Syndrome. So I was struck by this when I was reading it, by a specific subset or a specific patient population that we call patient X in your research. And Dr. Peterman, I was wondering if you could tell us a bit about patient X and anything else that you would like to elaborate on that you found in your research in the brief time that we have together.
Absolutely. Well, thank you for having me on the podcast, Michael. I really appreciate it. And I do just need to start by prefacing and saying that any information that I share with you tonight is solely coming from me as a practitioner. And although it is part of my practice at Advocate Aurora, I'm not speaking specifically to policies or what's happening in the hospital. It's just a little segue that we have to give as hospital employees. So that being said, patient X, this was really the way that I felt that we could break into the fertility clinics and have a absolutely essential role as TCM practitioners. I found that for many years, I got a lot of doors slammed in my face, or reproductive endocrinologists telling me that while acupuncture is great for stress reduction and the mind-body connection, they didn't think it did much else. And there was a lack of large-scale randomized controlled studies, which is true. We have some great research out there, but we do have a lack of those large-scale controlled studies. So when I started doing my doctorate, I needed to find a way that paved a way in. And that way in was looking at who are the women that are trying to conceive now and what makes them poor responders. And that's where patient X comes from. So patient X consists of a group of women who are of advanced maternal age, 32 or older, have PCOS, have spleen qi deficiency as their underlying root pattern, and who have struggled with infertility for at least, so they've been trying to conceive for at least a year with no luck. These women are also poor responders. And they tend to be patients that reproductive endocrinologists kind of run into some obstacles with. So that's the gist of who patient X is. Within that category of PCOS, we see a big problem with insulin resistance. And insulin resistance can run amok. With these patients, you can chase symptoms for a long time as a practitioner and not really get to the root cause, because insulin resistance mocks a lot of other patterns. For instance, these patients tend to have a lot of hot flashes, not because they're kidney indeficient, but because the insulin resistance is causing a problem. So you can waste 6 months trying to treat the wrong pattern. So a big part of patient X is defining the fact that they are insulin resistant, and that needs to be cleared up before you can truly move forward with your differential diagnosis.
Okay, very good. And did you talk a little bit about, within your thesis about how the modern American diet has created
yeah,
this?
Absolutely.
Could you touch on that just a little bit?
Yeah. So this is a big problem that started in the 1950s. A lot of you guys that are out there, you see this, you've heard of it. Marlene Merritt does a lot of research and talks about it. But in the 1950s, after the war was over, the U.S. had to feed mass amounts of people. So they came up with this hypothesis that they put out saying that diets high in saturated fat cause plaquing and they cause heart attacks. Oh no, let's take all the saturated fat out of our diet. It's cheaper to do that, right? So we started adding really high amounts of carbohydrates, really high amounts of sugar, and we took out all of the good dietary fats, making a whole group of people who really can't get satiated because they're not eating those good saturated fats. And now they're overeating carbs and they're overeating sugar. And so they're gaining weight and gaining weight and gaining weight and becoming insulin resistant and eventually diabetic. So this has gone on now since the 1950s. There was a point in time, and I'd have to look back to see exactly when that is, but there was a big article in the New York Times. It was called The Biggest, Fattest Lie Ever, where this was recanted, and we found out that saturated fats are... There you go, Michael. I lost you for a minute. Are we back on? That's okay.
I think we're okay. Yeah, the signal froze for just a second, so I wasn't sure. Hopefully I didn't leave you sitting for too long there.
No.
Okay, so I think I lost about the last minute or so of what you said, so I don't know if we talked about the importance. Sure. You and I were discussing briefly right before the interview about the role of a more paleo-style diet or a ketogenic diet in these patients and how well they respond. I'm not sure if you touched on that. I apologize if you did.
No, that's okay. I didn't. So just really that's my starting point, is getting them to a healthy diet, getting the saturated fats back in, getting them off carbs, getting them off sugar and off refined foods. And then that's about 30 to 45 days. At that point, that's really when you can start doing a differential diagnosis. And keto or paleo, either one of those are really great. In IVF, you oftentimes will go to keto because keto is quick and you need people to drop their BMI pretty fast.
And it works well. Do you find in patients, because spleen Qi deficiency is such a large player in all of this, how do they generally handle the ketogenic diet, particularly if it happens to be, at least in the beginning, a higher dietary fat aspect of things? How do they tend to handle that in terms of having weak spleens? Do you augment their spleens with herbal medicine? How are you approaching that?
Yeah, I only use acupuncture because I'm in the hospital. I can't use herbs.
Okay.
In private practice. So I was in private practice for years before I came on the hospital about 5 years ago. In the hospital, acupuncture works fine.
So trying to help patients in this capacity, especially in the hospital setting using acupuncture, what do you usually use in terms of acupuncture to help them? Like what are you trying to do primarily with acupuncture that we would ordinarily do with herbs?
Michael, I think I lost the first part of your question. Were you asking just what kind of point prescription? What's my treatment strategy?
Yeah, how are you approaching these patients in a hospital setting? Yeah.
So I use a lot of stomach 36, spleen 4, kidney 3, kidney 6, kidney 7, and then just really basically trying to really build them up so that they can get their digestion strong again and dry the dampness. So always stomach 40, always spleen 9. With PCOS, there's always that component of phlegm. And without herbs, it is tricky to get rid of. Mm-hmm. So, heavy manipulation on those phlegm drying points.
Okay. And are you using in the hospital setting or in the clinical setting, are you using Western labs to confirm progress on these things? Are we using imaging techniques? Yeah. What are some of the things that you're seeing there? What are some of the changes that you're seeing?
So you see their glucose go down, within 30 days, their glucose is down. A lot of times we have A1Cs on these patients, so we're using that. Recently, I had a patient whose AMH improved drastically within 90 days of really changing the diet and acupuncture twice a week and following this treatment plan. So that was kind of a shock to me. That was a new one. I rarely see the AMH improve, and it had gone from after her 40th birthday.
And what, as far as age ranges, what age ranges are you typically seeing?
So this, when we're talking about patient X, I'm talking about 32 and older. Most of my patients tend to fall between the 35 and 40 range.
Okay. All right. It's an interesting, because we both have shared being in Western integrative clinical settings. I worked at CNY Fertility, and you working within the setting. And in some settings, there are more limitations than others. I was able to use herbs, which is really helpful.
That's wonderful.
But we do, we work within, what we're capable of. But one of the things that I think working in, I would say, more mainstream fertility clinics, you get an exposure to a volume of patients that other practitioners just simply don't see.
Very true.
The level of exposure, I think, is what really gives you an ability to separate what's theoretical from what actually plays out in clinic. And you have a much more opportunity to try different types of treatments to see if one's going to be more effective in clinical reality versus, what it might say in the books. And since many of the books are coming from China, and not so many being published here from experienced practitioners in the States, it's really like we're on the front lines.
Right.
With the way that American or Western patients, modern Western patients, are getting sick or developing these types of conditions. So it's a great opportunity, and I think it's nice to have other practitioners that are in those settings.
Yeah, it's wonderful, and being able to validate what we're doing with those lab tests is it's so gratifying, because we see the shift in private practice. You could see it in patients. You see the shift, and you see that they're changing. You see their constitution changing.
Right.
But to have those numbers come back. For myself as a practitioner, for the patients, and for the providers, really, when you see a physician come in and say, "What did you do?
Yeah.
We haven't been able to touch this." It's a really cool thing.
Yeah, exactly. From within an integrated setting, that way, that there's oftentimes shock, surprise, disbelief from the integrative staff, because if the MDs come in and they say, "What are you doing?" And you're saying, "Well, I'm just treating based on the Chinese medicine. I'm treating on the Chinese medicine patterns."
Right.
And the labs are now reflecting this. It's great because, from being in my group, that I don't put any emphasis at all on treating the pattern based on labs. In other words, I don't make the pattern discrimination based on a lab, but certainly using labs to corroborate the success of a treatment is huge.
Right.
And it's great.
Yeah. And the really cool thing for me too, I certainly honor the roots of where we're coming from in our traditional patterns. And that's such a big part of me as a practitioner. But working in the hospital now for almost 5 years, you have to learn how to speak both languages.
Absolutely.
And I think our providers moving forward, the whole flavor of healthcare is changing. There's more and more hospital jobs becoming available. And we have to step up as a profession and be able to speak both languages and explain exactly what we're talking about when we say liver qi stagnation or spleen qi deficiency. Sure. And that's a lot of acupuncturists struggle with that. So
couldn't agree more. I always tell people, when you're outside of this type of conversation amongst professionals, you and me, you better be speaking Western medicine. You better be speaking those Latin roots. You better be prepared to explain things in that way. Between each other as professionals, it doesn't really mean a whole lot if we're trying to come to the root diagnosis in Chinese medicine. It's much more important that we talk spleen qi vacuity, we talk liver depression qi stagnation, we talk kidney vacuity, because the labs don't mean a whole lot with regard to us making a pattern discrimination.
Absolutely.
But outside of that professional context to the rest of the world, absolutely. I agree completely. Yeah, very good. Which actually leads us into the second part of this interview, which I wanted to ask you, and I know many people ask you on a weekly basis, how the heck do you integrate into a setting, in mainstream Western clinical setting as a Chinese medicine practitioner? What can you offer our listeners as far as advice?
Yeah, you've got to learn how to talk the talk and walk the walk. And you have to be confident when you're approaching the physicians. You're going to get a lot of doors slammed in your face. You're going to get a lot of providers who don't want to hear what we have to say. But when you can take real results to them and you can speak their language, it goes volumes. The key phrase that kind of always gets you in the door is, but this is a non-pharmaceutical intervention to ... Okay. The opioid crisis is huge. It's a tremendous problem. Physicians are acutely aware of it. Hospital organizations are acutely aware of it. They know that there's a gap that they need to fill. And when you can walk in and you can say, "Hey, I'm an acupuncturist and I have a non-pharmaceutical intervention, I can help you. I can help keep you out of the clear. I can give you some tools," they're more apt to listen. And that's really how I got my way in. when I'm talking the hospital side of things. Fertility is a little bit different because that's obviously not part of the opioid crisis. But when you're talking about neurologists, pain management physicians, cardiologists, those are going to be that's your kind of key phrase that gets you in the door. I was really blessed in my position where we have a large integrated medicine department. So I have a lot of support behind me. We have a team of, I believe there's 17 sites, and we have 13 or so acupuncturists on our team. So we have a pretty large group. I was number 5. So we've built that team since I've been there now. But that helps when you have a department behind you. But certainly on a daily basis, I'm storming into different physicians' offices and saying, hey, I'm here. Why aren't you referring to me? This is how I can help you. And this is what I can do. And it's always that non-pharmacological intervention are the key words.
Right. So not only are you making yourself present and known consistently, but you're also approaching them in a, what can I offer to you to mitigate your risk or to help you manage patients that oftentimes physicians that I think are getting stonewalled, or they just don't know what else to do with certain patients. When you come along and you offer something that sounds even vaguely reliable and yet non-pharmaceutical, they're going to dive on that opportunity to say, oh, good, you take care of this patient. Perfect. Yeah. Yes, that's great. And I think that that's big because you're approaching it from really like a coaxing of the ego perspective, right? A little bit of like, I can help you make things better for you. And
absolutely.
That's the game that you have to play, right?
It has to be that. It can't be, I can do this better than you, or we can manage this. It has to be, I can help you. I can free up some of your time. I can take these difficult clients off your hands. You kind of have to play that. And then before you know it, you start getting calls or emails or referrals of, hey, acupuncturist, I don't know what the heck to do with this patient. Can you help me? So it takes the time to build trust. And then anytime you can get a physician on your table, do it. So many acupuncturists are afraid to treat physicians. I've talked to so many across the country that just say, I'm afraid they're judging what I'm doing. I'm afraid they're not going to listen. But guys, we're the experts in acupuncture. They don't know anything about acupuncture. So when they come to us, they're coming to us to feel better and get better. And they're looking to us to be the experts. So we have to step up to that role. And I'm not saying that we have the same education or the same, level of experience that a physician would, because an MD is a little different. But I'm saying our medicine is powerful and we are very effective, and they do respect us. And we have to step up to that role. We can't belittle ourselves because we're afraid to treat them.
Yeah, there's a crisis of confidence within the Chinese medicine field, particularly in the West. And it's too bad, and it's the subject for another time. But I think in keeping this germane to our subject, basically stay humble and stay persistent is key. And I definitely can attest to that for sure. Be intelligent, be articulate, be patient, and really, stand in what you know, own the fact that you are an expert in a particular field of medicine, like any other expert in a field of medicine. I agree completely. I think this may be entertaining for others if you have any stories to share about catastrophic failures in terms of your approaching other healthcare providers, Western medicine, physicians, strategies that crashed and burned. Can you share a little bit about that?
Yeah. So I have had my share of those. I tend to be an overconfident acupuncturist. So I storm in with my studies and say, hey, this is what we can do. And the physicians kind of look at me and say, haha, there was 200 people in that trial. It's not worth anything. So the fertility clinic that I'm a part of, it actually took me 2 years to open. 2 years communicating with the physician, and we kept on going back and forth. And I kept on saying, hey, we can help with uterine receptivity. We can help restore ovulation. Here's the research. Here's the Steiner Victorian study. Here's all the stuff that we have that we really value in our field, because we know how hard it is to do a clinical trial. MDs do not understand how hard it is to do a clinical trial on acupuncture. They don't understand the implications of acupuncture and all the false positives. So when you go in and you say, we've got these studies, they look at us and laugh and say, you don't have any large scale randomized control studies. And I got so many doors slammed in my face for that. And I really had to eat crow, and I had to back up and say, okay, wow, this is why, and really explain sham acupuncture. So, being overconfident is a big problem too. And that's where I would say I've faltered the most. So when you go in and talk to them, do it humbly, as Michael said, and go in and say, hey, we have studies that are suggestive that acupuncture is effective in influencing this, but not acupuncture does XYZ. And I can tell you this because of this one study. Oops.
Dr. Peterman, thank you so much for joining us this evening. We really appreciate your time and your stories and your expertise. Certainly, those of you who are on TCM Gynecology regularly plan to see a lot more of Dr. Peterman. We have some things coming up in the new year. She's going to be teaching a few classes about PCOS. And then some specialty areas of PCOS. Also, we're talking about maybe doing something regarding integrating into a hospital setting as well in the form of a webinar, if that's of interest to you. So there's a lot of exciting things coming up for sure. Also, Dr. Lorena White will be teaching a class on uterine fibroids in March. So February and March is going to be busy on the group with some really great specialty webinars. Again, Dr. Peterman, thank you so much for taking time to
thank you.
Talk to us. Absolutely. And thank you all for coming out and listening this evening. I hope you have the great rest of the night. Dr. Peterman, we'll see you a lot more on the group. I think she's going to be much more active. So if there's any questions about PCOS, direct them in her direction. And we will see everyone on the group. Again, have a wonderful evening.
Thank you.